Everybody, it's Tom Judd here from CED. Had the privilege of interviewing Tazeen Bukhari from Pakistan, a great young clinical engineer there. Tazeen, tell us a little bit about yourself and how you got into this field.
I am a biomedical engineer graduate from Imperial College London. I came back in 2013 and started working for a private hospital in Pakistan. Then got lucky and got few consultancies with the government through DFID and World Bank. I worked with them. So I have a mix of experience with private organizations and some government organizations. Currently, I'm working as a consultant with WHO Pakistan and working on the COVID case management. So we're doing a biomedical survey uh, through all the health facilities in Pakistan to know like a baseline of biomedical equipment focused mostly on respiratory diseases, not
So
just COVID.
Tazeen, I know you were able to join us in Rome last year. So what's happened in Pakistan over that year? Are you encouraged for the profession?
Yes, I am, because COVID is a pandemic and it was very sad when it happened. But in terms of clinical engineering in Pakistan, the government has now realized the importance and they're focusing more on innovation, which is good. We've started manufacturing PPEs, respiratory devices, ventilators, uh, and our regulatory system is getting better as well. They're working on emergency user authorization and regulations for used and refurbished, which were not existent. So there was no regulation for all of these equipment. So that's a good thing on our part. And we are working on with you, of course, we're working on starting an organization for clinical engineering in Pakistan. We're hopeful we should get something soon.
Well, I know we've been talking with you about that and your colleague Faiza Shaukat that's located over in Boston in the US doing some graduate work and other colleagues. Yeah, tell us a little bit about, are there many clinical engineers, biomedical engineers in Pakistan?
They're not a lot, and the ones that are there are very scattered. They would be associated to one university, and they would be running like a small organization, and they would just stick to that. I've talked to a lot of people about doing something on a national level, but it's really difficult because there are 5 provinces, and every sort of group is happy in their own. It's very difficult to bring them to a national level, but we're hopeful things are improving and inshallah we'll get something done.
Sure. No, I was having a conversation with one of your colleagues in another country today and just saying, um, uh, Luis Fernandez, our webmaster and wonderful young guru, clinical engineer, working with CED out of Mexico, spent a year in Chile, and he got to know the private and public health systems there, and they're trying to start a society there. My point is, we need to be adding value to our profession, and that's what you're doing, that's what your colleagues are doing. So it's not just, hey, let's create a society. No, it's let's add value to the
Yes.
profession, and then people will come. And so I know that's what you guys are about in Pakistan.
Yes, we really want to start a CE training program or some short courses on giving people the direction once they graduate from universities about what should they actually learn and how are they going to practice their profession. So we would want to go into that eventually.
Well, that's so cool that you got this job with WHO Pakistan to work in Ministry of Health Pakistan. I know you mentioned about that. Say a little bit more. So what is that gathering that national inventory of the COVID related equipment been like?
It was a difficult task because the problem is that since I've already highlighted there are not a lot of biomedical engineers and most of the maintenance is corrective maintenance. There's no evidence-based or risk-based or preventive maintenance or calibration, so they don't have a proper record. Right now, I've only identified 23 biomedical equipment and oxygen supply systems. And the third thing we're focusing on is maintenance plan, just to know how many engineers are involved, are they properly trained, and what are the main causes that lead to non-functionality of medical equipment. We tried to take a bigger sample, but eventually people were a bit skeptical, hesitant. They did not want to share that data because eventually if you're highlighting that something is non-functional at the end of the day, it is coming on their shoulders. But I'm happy we are getting results and hopefully we should be able to present something.
So how does a young clinical engineer, young mom, how do you balance all these things in your life?
I think my family is very supportive, so that's like the major part. And I'm very motivated towards my field, and obviously I like to keep things balanced. It is going well right now. Let's
Tell
hope
us a
it
little
goes
bit about your
well.
family.
I have one daughter. That's about it. And my husband is an only son. I live with my in-laws. Yeah. And on my mother's side, I have one brother and two sisters. So
Very cool.
including me, it's four of us.
Sure. Well, if you would have one thing, well, first, before I get to the concluding remarks, tell us a little bit about what you spoke about in July at the Eastern Mediterranean Regional Office
So
CED COVID-19 discussion that day.
yes. So I was joined by a colleague as well. My part was highlighting about the situation in Pakistan because Pakistan reached its peak in June, and the situation was really bad then. But since then, we've improved, and we were like on the lower end of it. COVID has not completely vanished, but we were not peaking right now as compared to other countries in our region. uh, and my colleague talked about his personal experience. He came from a known hospital, Shaka Khan Memorial Hospital. They did some innovatory work as well, plus how they coped up with the whole situation, what were the measures they took, all of that.
Very good. And so, Global CE Day, what would you say to your colleagues around the world? And to your colleagues within your country, what would you say about this day?
So basically, I would say that I think you should just try and you will get succeed. It is a newer field in most of the countries, and it's really hard to bring the focus of the government and the regulatory bodies towards us. But we should just try, and I think we have all of your support, and we will get somewhere.
Well, it's been wonderful watching and speaking with you and Fez over the last couple of years as you've strived to improve, healthcare in your country, and
We've learned a
it's
lot
been
from you
fun to
as
be
well.
working with you guys.
Same here. We've learned a lot from you, and we hope to learn a lot more.
Well, thanks. We all contribute together. Appreciate your time.
Thank you
And
so much.
bye for now.
Bye bye.